Assalamu alaikum wa rahmatullahi wa barakatuh. Today we are going to continue our sessions about Station 5 in MRCP basic exam. I'm sorry for being late and Ramadan Kareem. Today we are going to discuss how to approach a case of acromegaly in Station 5 MRCP basic exam, which is very common case in the exam actually, and it is easy case to get the full mark. The scenario for this case can come in different scenarios in the form of visual disturbance and headache because of macroadenoma, which is doing compression of the optic nerve, and also specific lesion in the brain causing headache, and compressing the optic nerve also causing bitemporal hemianopia. Can come in the form of pain in both hands, or maybe pins and needles in both hands causing carpal tunnel syndrome, or maybe in the form of generalized fatigue and headache, and that's why, because of obstructive sleep apnea may be causing this headache and fatigue and the somnolence. So let's first to explore what's acromegaly and how much it affects the body of any body system, how it affects the body. We'll start from the hands here. In the hands you will see, we'll start from above downwards from the head. Here is the macroadenoma, enlargement of the pituitary gland causing headache, and compressing the optic nerve causing bitemporal hemianopia, and also change in the facial features in the form of enlarged tongue, macroglossia, and enlarged nose, enlarged lips, enlarged ears, coarse features actually, and also supraorbital bulging. Here in the neck it can cause skin tags, it can cause nigricans, it can be associated also with thyroid enlargement. Then in the arms it would be associated with proximal myopathy. In the hands it will cause spade-like hand or enlargement of the hands, and compression of the median nerve causing carpal tunnel syndrome. Then it can cause in the body, can cause enlargement of all the body system, enlargement of the heart and cardiomyopathy, so that we have to ask about cardiac symptoms, enlargement of the liver, enlargement of the kidneys. Also it can be associated with intestinal polyps, so it's the leading factors for colorectal cancer also. And it can be associated with hypertension and hyperglycemia, diabetes mellitus type 2. So again, there's an enlarged pituitary gland causing headache, causing compression of the optic nerve leading to bitemporal hemianopia, causing coarse fissures in the form of what the announce course is not preferred recently actually. Supraorbital enlargement or supraorbital bulging in the eyes by temporal hemianopia, enlarged nose, enlarged lips, enlarged tongue, dental separation, prognathism, enlarged ear. In the neck tags or skin tags, acanthosis nigricans, thyroid enlargement. In the arms, proximal muscle myopathy. In the hands, causing speed-like hand or enlargement of the hand, and it changes the size of the ring size that we have to ask in the history. Compression, cause also compression or stenosis of the median nerve, causing carpal tunnel syndrome. Downwards in the heart, causing cardiomyopathy and signs or maybe symptoms and signs of heart failure. Enlargement of all the organs, heart, kidney, liver. And the intestine, causing intestinal polyps and maybe colorectal cancer, which is highly associated with acromegaly. In the joints, it can cause osteoarthritis or pseudo gout, that we have to ask about joint pain. And it can be associated with high blood pressure and diabetes mellitus as well. It can be associated also or can be involved in men type 1. Men type 1 is hyperparathyroidism, so it can be associated with hypercalcemia and the symptoms of hypercalcemia of increased thirsty, increased constipation and low mood maybe, and increased frequency of water work or urination. And it can be associated with pancreatic tumor like gastrinoma, so maybe associated with acid brush sensation, heart pain, or maybe insulinoma as a part of pancreatic gland. So insulinoma can cause these spells, loss of consciousness, low glucose level. And this is men type 1 that we have to ask about. Other symptoms of men type 1 as maybe acromegaly may be a part of men type 1 in this patient. So again, to our case, as we know that station 5 is 10 minutes, 8 minutes with the patient to take the history, focused examination and to reply the patient concern, and then 2 minutes with the examiner to ask about the case, what's your clinical findings and what's your impression, diagnosis, and what's your workup to do. So whatever the presentation of the case, visual disturbance and headache, or maybe pain in both hands, or maybe generalized fatigue and day somnolence and headache also, as a presentation of obstructive sleep apnea. You have to start with the analysis of the complaint, whatever the complaint. Onset, course, duration, progression, factor that increase the symptoms, and the factor that worsen the symptoms, worsening factors, and improving factors, whatever the complaint. And then you have to take out to ask about analysis and ask about the symptoms of all the systemic involvement of acromegaly. For example, we'll start with the hands. You have to ask about any hand pain or any pain in the hands, okay? And of course, if there is anything positive with the patient, you have to do analysis of this positive symptom with the patient. For example, the patient has pain in both hands. So you have to do analysis of this pain in both hands. When this pain started exactly, is it coming on and off? Is it increasing, decreasing, or the same? Do you notice anything that increases pain in both hands, like movement or rest? Do you notice anything that relieve this pain, like rest or movement or any drugs, painkillers? What about the time of the pain? Is it more at the night? What about the grade of the pain from 0 to 10? 0 is the minimum, 10 is the maximum. And then to ask about any change of your rings, ring size or shoe size, any sweating. Okay. This is for the hands. Then the arms, any difficulty of combing your hair or raising up from a chair because of proximal myopathy. This is the question is for proximal myopathy. Then we'll start from then we'll go to from the head. Anyone noticed that you have change in your facial features, and you can ask the patient if the patient has any old photo or not to compare. Sometimes they are giving the patient old photo. If you ask it, that he will bring you the old photo or give you the old photo to compare. Anyone noticed change in your facial features? Any headache? And if there is headache, of course you have to do analysis of this headache. Onset, course, duration, site of the headache, type of the headache, and timing of the headache, and the grade of the headache from 0 to 10, worsening and relieving factor, and associated vomiting and visual disturbance. Of course you have to ask about visual disturbance, which is very important to ask about here. Okay, the eyes. Any change of your eyesight or any visual disturbance at all. And there is a special question to ask about temporal hemianopia, bitemporal hemianopia here. If you look straight forward, can you see the walls of the room or the sides of the road? Okay. This question is specific for bitemporal hemianopia. And ask about progression, because progression is indicator of active disease. The neck. Any skin changes of your neck. Of course, this patient may have skin tags or acanthosis nigricans. You can ask about any skin abnormality in your neck or any tanned skin of the neck as acanthosis nigricans. Any neck lamp of thyroid enlargement. This for the neck. Any snoring or daytime sleepiness and headache. This question for obstructive sleep apnea. Any snoring during sleeping or daytime sleepiness and headache and fatigue as a complication of overweight of the patient, which can cause obstructive sleep apnea. Okay. For cardiovascular system, we agreed that this patient may have cardiomyopathy. So you have to ask about symptoms of cardiovascular symptoms. Of cardiovascular system symptoms like chest pain, racing of heartbeats, cough, shortness of breath. And if there is shortness of breath, you have to do analysis of this shortness of breath. Is it on laying down or an exertion? And if it is for exertion, for how many meters? Does it awake you from sleeping, searching for air, for paroxysmal type of shortness of breath? Do you notice that shortness of breath when you are laying down for orthopnea? Any joint pain, because such a this patient may have pseudogout or osteoarthritis. For diabetes and hypertension, did you check your blood pressure before or your glucose level? Do you have any history of increased seriously or increased frequency of your rotor work? This is for a symptom of diabetes mellitus. This patient is highly associated with diabetes mellitus type 2 and hypertension. And if there is diabetes mellitus and hypertension, you have to ask about their control and last hemoglobin A1C of his diabetes mellitus. GIT GIT system. Any tummy pain or loose motions or blood in stool, this is for colorectal cancer, because all patient with acromegaly has to be screened for colorectal cancer. And then check for min 1 symptoms. As we know and as we saw before in this picture, this patient may have, or acromegaly may be a part of min type 1. Min type 1 can involve gastrinoma. You have to ask about heartburn and acid brush sensation, or these spells sweating, loss of consciousness for insulinoma, constipation, increased thirsty, headache, frequent urination as hypercalcemia of hyperparathyroidism. Min type 1 is hyperparathyroidism, and pancreatic tumor, maybe gastrinoma or insulinoma, and pituitary adenoma, which is acromegaly. Like that, we finished the case. The systemic review of the patient of acromegaly. Of course, when you go to the station, the case will be very clear for you. It is a case of acromegaly. It is not a case of differential diagnosis at all. It is a case of definitive diagnosis. In front of you, anyone can diagnose a case of acromegaly with a patient with coarse fissures, okay, and acromegalic fissures. But he wants you how to approach this case and how to review his systemic symptoms. And don't forget something in the systemic symptoms, and we covered all the system involved in acromegaly here. Again, rapidly review about the systemic involvement. Whatever the complaint, you have to do analysis of the complaint, onset of the complaint, course, duration, progression, worsening factor and improving factor. Then start with the hand. Whatever, you can start whatever you want, but we need to do it in a pattern that make it easy for you, okay, in anatomical matter or anatomical distribution that make it easy for you to approach, not to forget something. In the hand, this patient will have enlargement of the hands. You have to ask about any change of your ring size or shoe size, any sweating, any pain in the hands or pins and needles. And of course, if there's something positive, you have to do analysis of this symptom. If there is pain in the hands, when this pain started, is it on one hand or both hands, in which side of the hands, is it increasing, decreasing, or the same, is it coming on and off all the time with you, any diurnal variation, is it increased more at night? If we give this pain from 0 to 10, 0 is the minimum, 10 and the maximum, how much do you give this pain? Do you notice anything that increases pain like movement or rest? Do you notice anything that worsen this pain like rest or movement? Okay. Arms, any difficulty of coming here or getting up from a chair. Head. Anyone knows that you have your fissure has been changed than before? Do you have a picture? Can you show me your old picture, please? Do you have any history of headache? And if there is headache, you have to do good analysis of this headache. When this headache started exactly, is it increasing, decreasing, or the same? Is it coming on and off all the time with you? What about the character of this headache? Is it throbbing headache? Is it dull aching headache? Is it pulsating headache? Do you notice anything that worsen this headache? Do you notice anything that relieve this headache? If the headache from 0 to 10, the grade, how much do you give this headache? Any visual disturbance. And for the eye, we asked it before about visual disturbance. For the eye, any change of your visual sight. Okay, and there is special question for this bitemporal hemianopia. If you look straight forward, can you see the walls, the sides of the walls? Can you see the sides of the road? Okay. And if there is visual disturbance. What about the progression? Is it increasing, decreasing, or the same? Then the neck. This patient will have may have the neck skin tags. Here the neck skin tags. So do you have any neck abnormality or skin abnormality? Any tanned skin? Any lumps or bumps in your neck? This is for neck lamp for thyroid enlargement or thyroid lamp. Tanned skin for acanthosis nigricans. Skin abnormality like for skin tags. Still in the neck, any history of snoring during sleeping or daytime sleepiness and headache for obstructive sleep apnea. For cardiomyopathy, any chest pain, racing of heartbeat, short suppress or leg swelling. For any joint pain for pseudogout and osteoarthritis. Any history of diabetes, hypertension. Did you check your blood pressure before, your glucose level? Any history of increased seriously or increased frequency of water work for diabetes. And if there is hypertension or diabetes, you have to ask about their control, as it is indicator of active disease. GIT, any tummy pain, loose motions, blood in the stool for colorectal cancer. And ask about men, because acromegaly can be a part of men type 1. So any heartburn or acid brush sensation, any disease spells or sweating or loss of consciousness for insulinoma, any increased thirsty, headache, frequent urination for hypercalcemia. But you asked about increased thirsty and headache, frequent urination of diabetes before, no need to ask again. And then, like every case of station 5, ask about social history. And we have 4 questions in the social history you have to ask about. What do you do as a job, or what do you do for living, and how much your symptoms affect your job and usual daily activities. Refer the patient to social worker if his usual daily activities has been changed or affected. Refer the patient to occupational health worker if his job has been affected. With whom the patient is living and who is supporting the patient at home. What about your financial support? You drink alcohol? You smoke at all? Then medical history. Do you have any medical history of long-standing disease? Family history. Any family history of similar condition or long-standing disease? Then drug list of the patient. What's your drug list, please? This is a focus history for a case of acromegaly. Then, how to examine this patient? Focus examination for acromegaly. The examiner wants you to examine all the system or all the systemic involvement in acromegaly. You have to start to examine the complaint. If the complaint is visual disturbance, headache and visual disturbance, you have to start with the eye examination, of course. If the patient is complaining of pins and needles on both hands, you have to start with the hand examination and for carpal tunnel examination. Then we will start with the hand of the patient. Will be like spade like hand or enlarged. You have to check for sweating in the palms, palmar erythema. You have to check also for the pulse, maybe this patient may be associated with thyroid nodule and maybe hypothyroidism. Then for carpal tunnel syndrome. For carpal tunnel syndrome, you have to look for wasting of the thenar eminence, and then you have to examine for the motor power of the muscles innervated by the median nerve, which are loof muscles. Then you have to examine of the sensation of the median nerve, the sensation of the distribution of the median nerve. Upper limb, you have to make the patient to raise his arms against resistance for proximal myopathy. Then we'll start from the head. The head of the patient will has prominent supraorbital ridges, enlarged nose, enlarged lips, tongue, ears, prognathism, and interdental separation. Then the neck, you will see maybe skin tags or thyroid swelling or acanthosis nigricans. The eye. If the patient has visual disturbance or bitemporal hemianopia, you have to examine for visual disturbance. And if the visual disturbance is the main complaint of the patient, you have to start with eye examination by visual acuity, okay, by finger counting, maybe 2 meters away from the patient. Make the patient to cover one eye, and then give him number on your hand, how much is that, how much like that, and then make him to cover the other eye and to count your fingers by 2 meters. Visual fields for bitemporal hemianopia. Of course, the peripheral visual field will be limited for the patient bitemporally, and binasally the patient will see well. Cover each eye and make this visual field for each eye alone itself. Then ask for fundoscopy. Maybe the examiner will not give you a chance to make fundoscopy because you are going to lose time like that, to waste time. So just to tell the examiner, I'd like to do fundoscopy for this patient. He may let you to do, or he may not let you to do. Fundoscopy is very important because, you know, macroadenoma can do compression of the optic nerve, causing optic atrophy. Then for cardiovascular system, you have to check for signs of heart failures because this patient may have cardiomyopathy. You can check for the GVP. Auscultate basis of lung fields for crepitation. Examine the postular limb for pitting edema. And ask the examiner, I'd like to examine this patient blood pressure. This is for cardiovascular system. And take permission from the patient. I'd like to examine this patient abdomen for colorectal cancer and for organomegaly. I don't think that the examiner will give you a chance to examine the abdomen, just to show him you're approaching. Okay, this is how to examine this patient. Like we took the history, focus the history of the systemic review involved in acromegaly. We make also examination of the systemic involvement of acromegaly. Don't forget anything of these systems or any examination of that we discussed, because everyone is very important, and the examiner will put his eye on you while you are doing examination and how you are approaching your history taking and examination for this patient. Straightforward case, but just he wants you to make very good approach about the systemic involvement of acromegaly and examination of the systemic involvement of acromegaly as well. Ask about the concern. So what's your concern, please? What could be the cause of my hands pain, doctor? If the complaint is pain in both hands or pains and knees in both hands. Okay, I appreciate your concern. Most probably you have a condition called acromegaly, in which there is enlargement of one gland on your head, the master gland of the head on your head, secreting excessive protein called the growth hormone, causing your coarse fissures, visual disturbance, and compression on special nerve in your upper limbs, causing such as pain in your hands. This is explanation or simple explanation of what the patient has. So what we are going to do for you is to do for you further blood test and imaging of your brain to confirm our diagnosis. Then we will refer you to and then we are going to do a special test for you called nerve conduction study to confirm, to check your nerve conductivity or your cable or the cables of your hands in your upper limbs or in your hands. Okay, to confirm our diagnosis. Management plan. Then we are going to refer you to a gland doctor and nerve doctor and multidisciplinary team from a gland doctor, nerve doctor, and social worker maybe, and psychotherapist to give you the proper plan of management in the outpatient clinic. You can talk to him also that the treatment plan, the main treatment plan here is surgical operation of this enlargement. So what if the main complaint of the patient is visual disturbance? What could be the cause, doctor, of my visual disturbance? I appreciate your concern. Most probably you have a condition called acromegaly, in which there is enlargement of one gland or the mastoid gland on your head, secreting excessive protein called the growth hormone, causing your coarse fissures and also compressing the capillaries of your eyes, causing visual disturbance. So what we are going to do for you is to do for you first a blood test and imaging to confirm our diagnosis. Then we refer you to a multidisciplinary team from gland doctor, eye physician, and neurosurgeon, social worker, psychotherapist, maybe, to give you the appropriate treatment plan. The treatment plan or the main treatment for you may be surgical operation and removal of this enlarged gland. Driving, of course, if the patient is driving and he has visual disturbance, don't forget the issue of driving here. I'm sorry, you will be banned from driving because it carries risk for you and for the public, and you have to inform the DVLE about your condition. Don't forget driving in a case of the patient has visual disturbance, please. Very, very important. Is it treatable condition, doctor? Yes, treatment is available in the form of surgical resection of the enlarged gland. This is the best treatment for you. There is some medication, oral tablets or radiation, maybe before the surgery to decrease the bulk of the gland, or if you are not fit for the surgery. Then after that, the examiner will ask you, what's your clinical findings here, doctor? If the patient is complaining of visual disturbance, for example, this patient has acromegaly fissures and he has constricted visual field in the form of bitemporal hemianopia. I couldn't do fundoscopy for the patient. I want to do fundoscopy to check for optic atrophy. And you can mention other system for the patient, other systemic involvement. The patient also has large fissures in the form of big nose, big lips, and big ears, and prognathism, interdental separation, protruded suborbital ridges. The patient has enlarged hands also. There is no evidence of carpal tunnel syndrome. The patient has skin tags, acanthosis nigricans in his neck. There is no neck lamp. There is no signs of cardiovascular system involvement or no signs of heart failure. I would like to complete my examination by doing abdominal examination, rectal examination, and checking the patient blood pressure and urine dipstick for glycosuria. Okay. He will ask you what you are going to do investigation for this patient. I'm going to do investigation in the form of basic investigation, CBC, electrolytes, kidney function, liver function, and I'm going to do specific investigation in the form of insulin-like growth factor 1, which is a screening test, and also checking growth hormone after trial or after giving glucose 75 milligram, which will not suppress glucose, or which will not suppress the hormone, growth hormone. and the imaging in the form of CT brain or MRI brain, which is the best for the patient. What the treatment plan for this patient, doctor? Non-pharmacological treatment in the form of patient education and counseling, psychosocial support, occupational support, and specific treatment in the form of surgical operation, transsphenoidal hypophysiectomy is the treatment of a choice. Maybe medical treatment in the form of somatostatin analogs or dopamine agonists to decrease the bulk of the pre-operative, to decrease the bulk of the pituitary enlargement. Radiation also can be used, but medication and radiation if the patient is unfit for surgery, or pre-operative if the patient to decrease the bulk of the plate. He can ask you some other questions like which acromegaly patient, doctor, is for colonoscopy, screening for colonoscopy, when you are going to do screening or colonoscopy screening for acromegaly patient. All patients of acromegaly has to be screened for colonoscopy for colorectal cancer. If there is polyps, so the screening has to be done every 3 years. If no polyps, the screening has to be done every 5 years. He can ask you other question. What's the signs of activity of acromegaly, doctor? Or what's the signs of activity of the disease in this patient, doctor? We know that signs of activity of acromegaly is the presence of diabetes, or progressive or uncontrolled diabetes, hypertension, fatigue, progressive visual disturbance, skin takes, sweating. All of these are signs or symptoms of activity of the disease. I hope that so we covered all the case today. Very simple case to approach and very simple case to get the full mark. My best wishes, and I promise you to continue our stations for station 5 to finish all the station 5's, the most common cases coming in the exam. Thank you.